welcome to editorial on the trigeminal nerve, which is the cranial nerve number 5. So this is going to be the largest cranial nerve, and it's going to have a motor component and a sensory component, making it a mixed cranial nerve, though the sensory component is quite larger. Right? So your trigeminal nerve will have a V1 division, which is our ophthalmic division. Then it's also going to have a V2, which is our maxillary division. Then it's going to have a V3, which is your mandibular division. And functionally, it's going to have two components. There is the special visceral efferent, then we have the general somatic afferent. The special visceral efferent are going to be those fibers that are actually originating from the motor nucleus of the trigeminal nerve within the pons. And they're going to innervate muscles that are going to originate from the first arc, which includes your muscles of mastication, the mylohyoid, as well as the tensor palati and the tensor tympani. Then you're going to have the general somatic afferent fibers, which are going to be of two types. They're going to be proprioceptive fibers. Then you're going to have exteroceptive fibers. The exteroceptive fibers are going to carry the sensations of pain, touch and temperature from the face, except for the parotid where you have your greater auricular nerve. Then you're also going to have proprioceptive fibers for the muscles of mastication as well as the temporomandibular joint. And these proprioceptive fibers will actually relay in the mesencephalic nucleus, mesencephalic in the sense that it's located in your mesencephalon, which is going to be the midbrain. Then that brings us to a point where now you need to understand that the trigeminal nerve will have 4 nuclei. There's one in the midbrain, 2 in the pons, then there's one in your medulla. The one in the midbrain is this proprioceptive nucleus, which is going to be your mesencephalic. Then within the pons, we have the main sensory nucleus as well as the motor component. And from the medulla, we have the spinal trigeminal tract with its spinal trigeminal nucleus, right, making it the 4th nucleus of your trigeminal nerve. Right. So for the course of your trigeminal nerve, remember we said it is a smaller medial motor root and a larger sensory root that actually emerge from the anterolateral aspect of your pons at the junction between the pons and the mediocerebellar peduncle. Right. And the sensory root, when it actually enters the mediocranial fossa, it goes into a trigeminal ganglion, also known as the Gessarian ganglion. And the subarachnoid expansion over that ganglion is what we call the Merkel's curve. And from the convex end of your trigeminal ganglion or the Gessarian ganglion, from the convex end is where this trigeminal nerve is then going to divide into its 3 components. There's going to be V1, V2, and V3. Right? If you look at the V1, the branches from the V1 will pass through what we call the superior orbital fissure. Then branches from V2 or V2 itself, your maxillary nerve, will pass through the foramen rotundum. Then V3, which is going to be your foramen, will pass through your foramen ovale, which is going to be in the roof of your infratemporal fossa. So from V1, we get 3 main trunks rather, which is going to be the frontal nerve, you have the nasociliary nerve, then you have the lacrimal nerve. From the frontal nerve, you get a supraorbital and a supratrochlear division, and those are actually going to be purely sensory nerves from V1, and they'll innervate the scalp. Then you also get a nasociliary, then we get the lacrimal. From the lacrimal division, we'll get the infratrochlear, then you also get anterior ethmoidal and posterior ethmoidal nerves. Then if you look at V2, V2 will give you a zygomatic branch. There is a superior alveolar nerve. You'll be having both an anterior as well as a middle. Then after passing through your infraorbital foramen, it emerges onto the face as your infraorbital nerve. V2 and V1 are purely sensory, whereas V3 is the one that is going to have a larger sensory component and a smaller motor component, right? So V3, unlike the other 2 nerves, it's going to have a main trunk. The main trunk will give you 2 branches. There is the nervus spinosus or the meningeal nerve, which passes through your foramen spinosum to exit your infratemporal fossa to go back into the cranium. Then we also have the nerve to the medial pterygoid. Nerve to the medial pterygoid will innervate your medial pterygoid muscle, which is a muscle of mastication. It will also send branches to the tensor tympani as well as your tensor palati, right, for the palate. Then it will then divide into an anterior division and a posterior division. If you look at the anterior division, it mostly gives us muscular branches that are going to the muscles of mastication. But from that anterior division, we can also appreciate one nerve which is going to be a sensory nerve, which is going to be the buccal nerve. This buccal nerve will actually be sensory to the cheeks or the mucous membranes around the cheeks. Then the three other muscular branches, there's one for the masseter, which is your masseteric nerve. There's the deep temporal nerve for your temporalis muscle, and there's the nerve to the lateral pterygoid, which is the landmark of your infratemporal fossa. Right? Then from the posterior division, we have purely sensory, except your inferior alveolar nerve, which you add by giving a nerve that goes to the mylohyoid as well as the anterior belly rather of your digastric muscle. So there's auriculotemporal nerve, which emerges by two roots, and the two roots are going to enclose the mediomeningeal artery, which is coming from your first part of the maxillary artery, also in that infratemporal fossa. Then this auriculotemporal nerve, it will give you sensory branches to the auricle of the ear. It will also give you sensory branches to the temples, the scalp. It will also give you branches that are going to the temporal mandibular joint. This masseteric nerve will also innervate your temporal mandibular joint. Then we have the lingual nerve. The lingual nerve will give sensations to the anterior two-thirds of your tongue. And traveling within it, you have the quadrant tympani nerve from the facial nerve, each hiking through it. Then we have the inferior alveolar nerve, right, which will also end by giving us the nerve to the mylohyoid, meaning to say it's not a purely sensory nerve. Then if you look at the divisions of your trigeminal nerve, these are going to be topographically related to ganglia within the parasympathetic nervous system, but functionally those ganglia are related to other cranial nerves, meaning to say the trigeminal nerve on its own, it doesn't carry any parasympathetic nerve fibers. Right? So we have the otic ganglion. The otic ganglion is connected to the mandibular division of your trigeminal nerve, but functionally it's related to the glossopharyngeal nerve, which is your cranial nerve number 9. So you're going to have your glossopharyngeal nerve, then it forms the tympanic plexus in the middle ear. Then exiting that will be the lesser petrosal nerve, which then exits the cranium via the foramen ovale to gain access into that infratemporal fossa. And that nerve will then synapse here at the otic ganglion, which is topographically related to this mandibular division. Then from that otic ganglion, the nerves will each hike via branches of the mandibular, which is going to be auriculotemporal, to gain access to the parotid. So the final relay pathway from the ganglion to the gland will actually be a branch of this mandibular system, which is going to be the auriculotemporal. But originally, the branches are coming via the lesser petrosal, which is from the glossopharyngeal system. The same can be said for the pterygopalatine ganglion. The pterygopalatine ganglion, you can refer back to the video on cranial nerve number 7, but this pterygopalatine ganglion is topographically related to your maxillary division of the trigeminal nerve, but the nerve fibers that are actually going to enter the pterygopalatine ganglion are going to be your greater petrosal nerve, which is going to originate from the geniculate ganglion of your facial nerve, and it's going to relay its fibers to the lacrimal gland for lacrimation, as well as some glands in the nasal cavity and the palate. Right? Then clinically, you can have inferior alveolar nerve block for dental procedures. You can also affect the lingual nerve when you are removing an impacted third molar tooth. That is in 10% of the cases, it's going to be at risk of damage. Right? So that's just about it. Thank you for watching.